Hello, and thank you for joining us for another episode of Hope for Healthcare with Dr. Katie Cole in partnership with ICD Healthcare Network. Dr. Katie Cole is a holistic physician, organizational well-being consultant, and change agent, working with industry leaders and proven strategies to heal our national healthcare system and our culture of medicine. Stay tuned to hear today's speaker.
Welcome everyone to Hope for Healthcare. Today I have a very unique and special guest with us. His name is Bob Chapman. He is chairman and CEO of Barry-Wehmiller. He was recently named the number 3 CEO in the world and a top 10 social capital CEO by the International Business Times. Bob is very intentional about using his platform as chairman and CEO of Barry-Wehmiller to build a better world. He has been applying this unique blend of strategy and culture since 1975 and has led Barry-Wehmiller through more than 115 successful acquisitions with over $3 billion in revenue. Over the past 2 decades, he had a series of realizations that led him away from traditional management practices to a more people-centric style, which he calls truly human leadership. At Barry-Wehmiller, they measure success by the way they touch the lives of others. Well, welcome, Bob. We are so happy to have you as a guest on our podcast today.
I honestly look very much forward to the opportunity to share these beliefs with your listeners in hopes of creating a more caring world for everyone.
Yeah. Well, so would you please tell our audience a little bit more about your background and how you became interested in designing the concept of truly human leadership?
I think relative to your audience, I was raised in a very traditional environment, family, went away to get a degree in accounting from Indiana, MBA from Michigan, and I went to Price Waterhouse, and then I joined the family business about 1969. And so I say the first half of my career was defined by what I was taught and what I experienced, which was management. I took management classes, got a management degree, and got a job in management. So I thought my job was to manage people. Yeah. That was that, and I was successful at doing that. The company, I transformed this old company through a vision of a better balance of markets and products and technology through acquisitions. So I'm not an engineer, so I can't invent new things. So I had to acquire companies that had products and then try to bring them to market more successfully. So we were very successful in acquiring companies and making them better. Okay, we didn't acquire to fix them up and sell them. We adopt companies. And so today the company is about $3.5 billion in sales, 12,000 people around the world, now over 120 acquisitions. And so that environment is, and again, traditional manufacturing. We manufacture capital goods in general for people like Procter & Gamble, Anheuser-Busch. So that's my business experience. And again, my first half of my career was all about profitability, growth, and our share price. I had a series of revelations, though, that occurred starting in about 1997 that took this lens through which I saw my responsibility, which was management. And let me I have come to define the word management to mean the manipulation of others for my success. And the transformation that I'm going to share with you took that lens through which I saw people as functions, engineers, accountants, hourly workers, salaried workers, receptionists. I saw people as functions for my success. Through these revelations I'll share with you, that lens got reversed to where I saw the people I had the privilege of leading as somebody's precious child, knowing that the way I treated that person in my care would affect their health, and affect the way they went home and treated their spouse, their families, and behaved in our communities. Because in my education, I was never taught that the way I would lead our company would be a major factor in the health of our team members and be a major factor in the way they go home and treat their spouse and kids. So the the transformation was 3 individual events. First one happened in 97. I just acquired a company in South Carolina. It was March. What happens in America is March Madness. I walked into this company I just acquired, about a $55 million company in South Carolina. And everybody was talking in the lunchroom in their coffee before the office opened about which teams won. And I had to go back and reconstruct this because all I was doing was kind of watching people have fun talking about which college team won.
Mm-hmm.
And I wasn't paying much attention. I was just watching them. But obviously what was happening in my mind was a revelation because the closer it got to 8 o'clock when the office opened, you could just see the fun go out of their body as they went to work. And so that day, my first revelation was, why can't business be fun? Why do we call it work? Okay. And that led me to create some games with that company, just spontaneously create some games like I'd just seen people in March Madness, which were just games. And we engaged people in games that created value for the company and was fun and competitive for them. And we saw a major transformation in our culture because people all of a sudden were inspired, not managed, inspired to serve our customers better, to secure orders from them. And so we were astounded at this simple idea of making business fun, how it changed the performance, but more importantly, how it changed the culture. The impact on joy was astounding because all of a sudden people had fun, were competing, they were being right. So anyway, that was first. Second was Cynthia and I are Episcopalians, we're in our church, and the rector of our church was my mentor. And one day I looked at Cynthia and said, Cynthia, Ed is our rector, has only got us for an hour a week. We have people for 40 hours a week. We are 40 times more powerful to impact people's lives. And as I walked out of the church that day.
Yeah, that just gives me chills having that.
Well, I mean, it never occurred to me, but I said, we have people in our care for 40 hours a week. The way we treat them, we are 40 times more powerful than our faith to give people a sense of purpose and meaning. So, and the last one was at a wedding when I was watching a friend of mine's daughter be married to another friend's son. And I realized during the wedding, as we were all enamored with how precious this young couple was at the commencement night, what we realized, that was the deep transformation everybody remembers. All of a sudden, I said, all 12,000 of our people are just as precious as that young man and young lady. And what it caused me to realize is that people are not functions. They are somebody's precious child in our care. And when you see people not as functions for your success, but you see people as your purpose is to give them life, a meaning, and purpose, it profoundly changed the way I saw my sense of leadership. Leadership is the stewardship of the lives entrusted you, but you can't ask people to care. You have to teach people how to care. So I went from management, which is I call the manipulation of people, to leadership, which is I thought was the stewardship of the lives entrusted you. That was the big transformation for me. It didn't, and what it did is took a good business and made it better because now people shared their gifts. We didn't do it to get more engagement. We didn't do it to get more productivity. We did it out of a sense of responsibility to treat these people with dignity and respect while they're in our care. And it's created what is now considered one of the more unique cultures in the world. Bill Urey of Harvard described it as a place where he saw the potential for world peace in the world.
Yes. Well, and I know that by the way, this is a New York Times bestseller book, Everybody Matters. And Bob Chapman co-authored this book with his colleague, Raj Sisodia. It's a great book. I urge every one of you to order it and read it. It's full of so many tools and tips. And Bob, what I really appreciate about your book is that you take us through your whole process of, the beginning of your company and taking over as CEO from your father, and how it was a struggling company for a while, and you were really able to turn your company around into a thriving culture. Can you tell us more about some of the strategies that you implemented to do that?
Well, first of all, if you start with embracing a leader's responsibility, whether you're leading a hospital or you're leading a department in a hospital, is to give the people in your care a grounded sense of hope for the future. Okay, that is your primary responsibility. So what really happened that allowed me to transform it, because when my father died in 1975, I tried to take the company that I had joined 6 years earlier, that my dad had acquired in the 1950s, that was struggling, and I tried to take what he had done and make it better. And I realized in 1983, the short version is that our history, I'm proud of our history making bottled washers and pasteurizers for the brewing industry, but our history did not give us a future. And as a leader, my responsibility is to give our people a future. So I had studied a company called Emerson Electric that grew through diversification of industries and markets and products. So you're not betting everything on one market, one technology. And so I began looking for acquisitions that would allow us to get into markets that had a better future. My only problem was I didn't have any money and I didn't have any experience. All I had was passion. And so I survived those inadequacies of money and passion. And I began acquiring companies that I thought were in markets and products that gave us a better future, which is my primary responsibility to our people. You cannot, it's not just about being nice. It's making sure you have a good business model, a good financial foundation, just like you would as the wage earner of your family. If you don't provide sufficient income to your family, you cannot be good to your kids in terms of providing shelter and housing and education. We cannot be good to our people in any organization unless we have a business model that gives them a sense of safety against the future, so they can buy a home, raise a family, and not go home worried about being laid off or downsized or salary cut. So I would say to you that transformation was when I had studied this company called Emerson Electric that had grown through acquisitions. And I took a very conservative view. I tended to look for companies that were struggling that I thought I could fix their problems, and I was able to. So today, we have a thriving company in markets that have good growth potential, and our people don't worry about getting laid off or downsized or plants being shut down. They feel safe. They can come each day, look forward to being a part of probably the most interesting thing is people, when interviewed, describe it as a family. They don't describe it like a family. They describe it as a family. And I ask myself, why do they use the word family? They're not related. Because what does family mean in our culture? The place of ultimate safety and care, right? It should be your family.
It should.
So people describe the company as a family. They feel safe, cared for, and get to express their gifts and go home each night feeling valued. And again, I want your audience to realize that 95% of the feedback we get from this effort to convert managers into leaders who care is how it affects their marriage and their relationship with their children. Rarely does somebody say, as a result of what we teach at Barry-Wehmiller University, does it make them a better leader of our accounting department or marketing department? Because we touch people so deeply in terms of sense of responsibility, of caring, of listening, of recognizing and celebrating the goodness of others, that they go immediately to what's important to them, which is their family. So again, biggest transformation to me from a business standpoint was through acquisitions to get into markets that had a better balance, that were not dependent upon any one customer and technology. And from a cultural standpoint, when we realized that people are not functions, they're somebody's precious child in our care. So that's really how the transformation of the business occurred.
Well, thank you, Bob. I mean, thank you for really unpacking how you went through that transformation with your organization. And I think you're just such a unique human being and individual and leader and are globally really being a champion for bringing caring back into the work environment and seeing everyone as a human being and an integral part of actually being the product. Our people are our product, like you've talked about. So I really appreciate you talking more about that.
You said that, and let me tell you, I was interviewed by Washington University professors, organizational development professors a few years ago. After an hour and a half interview, they said to me, Mr. Chapman, you are the only CEO we've ever interviewed that never talked about your product.
Yeah.
And I paused and I said, I've been talking about our product for the last hour and a half. It's our people. Yeah. I won't be proud of the machine. I won't go to my grave proud of the machinery we built. I'll be go to my grave proud of the people who designed and built that machinery. And that really startled them.
Well, and you recently talked at the National Healthcare Burnout Symposium a couple weeks in New York, and I was there and got to meet you in person. And one of the quotes that you said was, "We build great people that do extraordinary things," and that really struck me. You know,
as you know, again, it's all part of this transformation of seeing our business defined by products instead of being defined by the people who create those products. And so we give a lot of credit to the Industrial Revolution for creating economic prosperity, communities, factories, better paying jobs, better paying healthcare. But what happened was, and I think this is relevant to your group. I went back and I was asked at Brown University to talk to university presidents. So I went up to Harvard and I said, what was the purpose of education? I said, the purpose of education was to have an informed citizenry so we could have democracy. I said, yeah, but then the Industrial Revolution came along and the brilliant Henry Fords of the world and the Rockefellers, they needed skills to fill their factory because tremendous wealth was being created. And we thought by inviting people off farms into our communities and better paying jobs and better benefits that we would create happiness in the world, because the thought was money would create happiness. Better paying jobs, better benefits would create happier people. But the flaw, they didn't ask for better leaders. They asked for skilled people. So we brought in accountants, engineers, lawyers, and we promoted them to leadership position without any leadership skills. And so what we have is we came together in organizations without leaders. So people were put in positions to achieve results, not human prosperity, not human value, but financial results. And rewarded the people that did that. So that's where the system broke down. When we created these organizations where people came together and brought diverse skills together to create Ford Motor Company and all these other great companies, we forgot one thing. We forgot we need people trained at being leaders, okay? And so our hospitals, our retail. So today we say we have a culture where we have the highest level of depression and anxiety we've ever had.
Absolutely.
Why? Because people have money, but they don't feel valued. And as Tom Friedman said, we don't have a poverty of money, we have a poverty of dignity.
Yeah.
And when people don't feel valued, they feel a sense of humiliation, which will create anger and unrest like you've never seen before. So I would say to you, every angle I get, every part of our society, whether it's healthcare or business or the government, people don't feel cared for. They feel used for the organization's success. And you can't simply ask now the leaders of our hospitals, the leaders of our medical profession to start caring for people. We need to teach people how to care. It is a teachable skill that we teach in our company and has resulted in a transformation of our culture. People come in and say, from all over the world, McKinsey, Harvard, et cetera, and say, I've never seen anything like this. And it touches me, because how could an accountant with a normal background have created something that the world is watching? Because I believe some higher power has blessed us with this transformational journey to try to show the world the way we are intended to come together, where people are our focus around a business model that gives them a sense of safety and future, and we see people as our purpose.
Well, Bob, that's a really interesting point, because in medical school and residency training, as physicians and nurses, we're taught to care for our patients. I mean, we get so much training in how to show empathy, motivational interviewing, things like that, but we're not taught to care for each other. And then, we seek leadership training. As a physician, I've sought out additional leadership training in my career. And it's really all about managing systems and flow and streamlining and increasing profitability for the healthcare system, right, and managing a little bit of personality dysfunction too. But we don't really get that education on how to care for each other. And can you elaborate a little bit more about how you were able to do that for your organization?
Yeah, I was on a call with a couple of people in your profession just a couple of days ago, and the one gentleman was formerly a CEO of a major hospital, and he said, Bob, as CEO of a hospital, we have tremendous demands on our time. All the regulatory agencies that oversee us and the funding from Medicare and the government and so forth. There's just not time left to care.
Oh, gosh.
And I said, how can caring organizations not have time to care? We need to put the care back in healthcare, okay? And I want to tell your listeners a really brief story, but it's 10 years ago, Cynthia and I were at the Ritz-Carlton Hotel, and we were having breakfast, and a lady was waiting on us, and she was amazing. And I finally said to her, I said, ma'am, what did they do to you to cause you to treat me with such thoughtfulness? And she said, without hesitation, she pulled out a card that made a profound impact to me. It said, ladies and gentlemen, serving ladies and gentlemen. I said, what does that mean? She said, they care about me and I care about you. And that led me to the work I've been doing in the healthcare industry, where I tried to take that idea and extrapolate it to healthcare. And I said, why wouldn't it be loved ones caring for loved ones? Why aren't the doctors and nurses, the staff of the hospital, just as important that we care for as opposed to the patient, stakeholders? But the problem is you can't ask a hospital administrator to care. You have to teach them how to care, okay? And caring in our organization starts with empathetic listening, which is a skill that we teach, which people say it changes their life. We also teach recognition and celebration. How do you let those people know in your care that they matter? How do you make sure that a day doesn't go by without you look, it's called shining a light in the organization, looking for the goodness and hold on saying, thank you, Katie. You made a real difference in the lives of people. And you go home at night feeling, yes, it's hard. Yes, there's a lot of demands, but boy, is it worth it because I feel valued, okay? So we don't teach that in most organizations, how to recognize and celebrate the goodness of others. And we don't teach empathetic listening. What is the greatest skill a nurse or a doctor could have, or a leader? Is the ability to listen, to validate, not listen to judge or debate. Yes. And so that's what we have found in our journey that has transformed. When you teach people that we're all uniquely created differently, and listening is a skill that needs to flex to the personality type you're dealing with, it changes everything, Katie. I mean, I would tell you that is the foundation of truly human leadership. To see people not as a function, but to see them as somebody's precious child that's been placed in your care, knowing that the way you treat them will be a profound impact on their health and the way they go home and treat their families. So that is a key thing I want. So I have found in the work I've done so far in hospitals, in medical organizations, we have doctors that could get promoted into leadership positions without any training on how to care for the people you have the privilege of leading. It tends to be focused on the patients, the financial performance, but public different. They're not taught to care for people. They are taught to make earnings per share, share price increases, et cetera. So we just have got a broken system. So what you're experiencing in healthcare, we experience in education, we're experiencing in the government, we're experiencing in the military. We just don't know how to care. And we have learned it is a teachable skill. Starts with empathetic listening, recognition and celebration, and culture of service.
Yeah. And I remember one of our chief medical officers actually asked you the question at the symposium, is everyone teachable? Or all leaders teachable?
The answer is everyone's teachable. Okay. And we have a gentleman named Randall Fleming who Harvard went berserk over because they saw a massive transformation from a gentleman who wanted nothing to do with any of this, who eventually, through courageous patience, eventually decided he wanted to be a professor to teach people how to care. And this was an extreme example. And Randall today is an example of transformation. So I would say to you, we have courageous patience. We understand everybody's had a different journey to where they are right now. We can't expect everybody to feel the same way and be ready to step on the bus. So we focus on the early adopters, the people who do believe, and welcome those others into the bus when they're ready to get on the bus. And again, We're 100 locations in 28 countries with 12,000 people. This is a universal truth. Okay. Again, as I told you, I speak in every part of society and I see the exact same issues. We just in our society are not teaching people how to be leaders. We're teaching people how to achieve organizational goals and using people to do it. They may be a nice person. You may be fortunate to work for a nice person, but that's an accident. Okay. We want to be intentional. We believe it's everybody's right to work for somebody who genuinely cares about them.
Mm-hmm. And, you have been able to witness this and study this, and you have data in your organization to show that by really investing in your people as an integral part of your business, it has helped your profitability over the past several decades.
Yeah, I would say to you, we didn't do it to amplify our profitability. We did it because those awakenings, those revelations I had, where I began to see people as somebody's precious child and knowing that I have impact. The result has been taking a good business that's doing well and making it do better. But we don't say that at all, because if your reason is to improve the performance of the organization, you're starting with the wrong reason, okay? Your reason is that these people are somebody's precious child, and the way you treat them will profoundly affect their life, okay, and health. We're told by one major institution that the person you report to at work is more important to your health than your family doctor. So, and I was never told that. I was never told that the way I would treat people would affect their marriage and their health and the way they treat their kids. So when we wonder what's wrong with kids today, where do these kids come from? They came from our families, probably from parents who worked for a company that didn't care about them, came home from work pretty stressed or demoralized, and they saw their parents not necessarily know how to treat each other. And so the kids are a product of the homes that we have, where the broken homes caused by, they got jobs where they don't feel valued. So this poverty of dignity. So we are creating our own healthcare crisis. When I talk to CEOs of companies, I say, you're all concerned about the cost of healthcare. You are the problem. 74% of all illnesses are chronic. The biggest cause of chronic illness is stress. The biggest cause of stress is work. We are self-destructing for economic gain, and nobody knows how to break that vicious cycle.
Well, and I think, Bob, you have a model that's working so well for your organization, and you developed your own university internally to not only teach your employees and educate them on leadership and caring, but you're also able to educate other industries globally, like you're working with the police and the education system. Do you have any tips for our healthcare administrators and where they can begin if they're listening to this podcast today?
Well, first of all, I tell people, they say, well, how would I begin? I say, well, first of all, there's an animated TED Talk that I did. The TED Talk I did that got animated. It's only 9 minutes long.
Okay.
You can sit down with a couple of leaders and say, how does this message, you listen to the podcast, then you watch the TED Talk. It costs you nothing other than a few minutes, okay?
Okay.
If your appetite is whet, you want to study the book and say, do these principles, because the purpose of the book is called A Hero's Journey. How did I get from management to leadership? And then how do you do it? So the first third of the book is my journey. The second is how do we transition? So again, the publisher told us it's now sold well over 80,000 copies around the world in 7 languages. And apparently a good business book sells 5,000. So the message has been validated. And we're told that the case study that Harvard did about 6 years ago has now become a Harvard bestseller. And it's 70 universities from Japan to India use it to teach leadership. So the message I just shared with you has not been debated by anybody. Nobody debates in my 15 years of talking. Nobody debates what I just said. It's so, unfortunately, it's so far from what we teach and we practice.
Yeah.
Nobody debates there's a moon outside, but it doesn't mean you know how to get there, okay? And so I would say to you, to all the listeners, watch the animated TED Talk. It's, the animation makes it more interesting. Then if that makes sense, there's a lot of my talks on the internet that are free. And finally, read the book and say, does this make sense? And then there's many organizations. We have a leadership institute, Chapman Leadership Institute, that goes out and helps major corporations learn to care. And we are working with a few in the healthcare industry now, and a couple of calls from your conference, probably going to be a few more. But we say,
Great.
how do you bring, and I would say to you, we were given a chance by one of our major investors to visit a regional hospital in Austin, Texas. And I gave the message you just heard to the trustees and the head of nursing and the doctors. And so there's probably 30 people in the room, a couple hour talk. And at the end of it, the doctors and the nurses cried. They said, nobody cares about us. So what we need is we need leaders in healthcare who embrace the profound impact they're going to make, not just on the patient's life, but on the life of the caregivers. And I use the analogy, we need to move to loved ones caring for loved ones. We need to focus as much attention on the people in our span of care, in our hospitals, in our medical practices, as we do the patients. Because do you want somebody caring for you or your loved one in hospital who doesn't feel cared for themselves? Mm-hmm. Right? Because we have found that caring is contagious. When you feel cared for, your capacity to care is amplified dramatically. That is what people observe in our company. So if your caregivers don't feel cared for, how can they possibly care for the patients at the level that those patients deserve? Okay.
Well, I mean, that was such a powerful and impactful message, Bob, and hopefully I can capture that. You know, everyone, I will be posting all of this information on the website. Bob will have his own webpage. I'll also upload his TED Talk as well as a link to his book. So these are some great pearls that we've talked about today, Bob. And, you know, you've been called like an eternal optimist, right? Before, that's one of your nicknames.
Yeah.
Well, that's why I called my podcast Hope for Healthcare, because I also am an eternal optimist.
Well, that's, Katie, that's incredibly important. As leaders,
yeah,
our responsibility, I want to repeat that, is to give those people in our care a grounded sense of hope for the future. So that when things that happen, which they happen every day, we can deal with them in the context of where we're going, okay? But if all we do is jump from issue to issue, that's not leadership, okay? Mm-hmm. And so I would say to all the leaders in this, the most fundamental skill I want to remind you is to learn to listen with empathy, to understand and validate, not debate, to understand we are all uniquely created. You can't lead all people identical any more than you could treat all your kids and your family identically, because they're uniquely different. Mm-hmm. So probably I think the biggest thing I've learned in the last probably year is that we're all born with a personality type that determines the way we see the world. That's why a family of 3 can have 3 uniquely different children of the same parents in the same community, because they have a uniquely different lens through which they see the world. And when you learn to listen, you see the uniqueness. You don't judge people, you begin to understand people, and people feel validated. So I would say to the caregivers, we need to learn to care for the caregivers, or we will never be able to give the care that our patients deserve. So caring starts in the house, not in the way we treat our patients. Because if we treat our caregivers properly, we're not going to have burnout. They're going to work hard, but they're going to feel valued, and they're going to feel touched in people's lives. But when you put the load we do on healthcare workers, and then they don't feel cared for, you're going to see exactly what we're seeing right now, which is a burnout, because they don't feel cared for. They feel used for the hospital or the nursing homes, whatever's purposes. And because they're not bad people, these leaders, they've never been taught to care for others.
Yeah, well, thank you. Thank you so much, Bob. And I know we need to wrap up for today, but I want to thank you so much for, being a guest on Hope for Healthcare today and really giving us some food for thought, and I really appreciate your honesty, your authenticity, and your messaging is simple and consistent. And that's what I also really appreciate about you. So thank you.
Well, the beauty is I was blessed with a very simple mind, which has allowed me to see things other people with more intellect are unable to see. And that has given me this chance to, my goal is that this blessing I've been given of seeing the world the way I do does not die with me, that we create a movement. People like you and others on this podcast, that we can inspire people to a higher level of calling to learn to care for others.
Well, thank you, Bob. And thank you all for tuning in today. And I will be posting all this information so you have it available to you.
Thank you.
All right. Thank you, Bob. Thanks for being a guest today.
Thank you. Bye-bye.
All right. Bye-bye.